I was always fascinated with human behavior. I grew up in a family that had a lot of dynamics, probably like most of us do, and subsequently met a few patients when I was in college and grad school, taking some classes on neuroscience. And they taught me certainly beautiful neuroscience and things about the brain. I'm a neurologist trained in autoimmunology, so diseases like multiple sclerosis or Devic's disease or other autoimmune conditions that can affect the white matter disease of the brain are good things for me to see. I can see that those also impact the brain and the spinal cord, often the optic nerves. The one thing patients tell me here after we spend time with them that often surprises me is the amount of time we get to spend with patients. I have usually about an hour to see a new patient. And pretty quickly we can do an exam and collect the history and the basics, and the rest of that time we spend talking like human beings, reviewing their images together, talking through what the testing means, and trying to co-develop a game plan for what's going to work in their life, what won't work, how often they want to come back, do they want to see their local neurologist and coordinate with us in the passenger seat, or what works best for them. And so oftentimes, although there are many we see as a single referral and recommendation, oftentimes the beauty of multiple sclerosis for me as a clinician is I get to walk that journey with people. And these are people I've known for decades. I know their families, I know what's important to them, and fills a space in my heart to be able to have that privilege. I think the placement of that trust is something I have to earn, creating space for it, hearing things without judgment, sometimes just sitting in bad news or the yuck, and making sure they feel like they've got a partner, no matter whether we're in agreement all the time or we have differences of opinion, trusting that we both have our own expertise that can make us better together. I'm someone who will always place the human at the center of our conversations and decisions. And if that's something that feels good to people, I want them to know that I'm in their corner, advocating for them, partnering with them, and I'm not going anywhere.